Good afternoon and welcome to ParentTown. I'm Roshni here and I have Dr. Titus Wu here with me. Hi Doctor, thank you for joining us today.
Thank you for having me here.
So we're here in sunny Singapore and we're going to be talking about a very interesting topic, which is childhood myopia here in Singapore. The topic for today is actually dealing with myopia in the digital age. And Singapore, unfortunately, has one of the highest rates of myopia in the world. Around 80 to 85% of the adults here in Singapore have myopia. 1 in 2 children end up with have myopia, and we have got one of the highest rates of myopia for kids between the ages of 7 to 9. Myopia is also known as shortsightedness, and it's a huge issue for us here, and not just here in Singapore, but it turns out all across Southeast Asia we have growing rates of myopia. So we decided that we're going to start off our first Ask the Expert session with Dr. Titus Wu, who is one of the 2 certified or accredited orthokeratologists here in Singapore.
Really an honor to come here. Thank you very much for having me. Thank you, everybody.
So the way it works is, for all of you guys who are tuning in, just ask your question on the childhood myopia topic on ParentTown app or on the website, and the questions which get the most amount of likes or upvotes will then be sent to me on my phone, and we'll be asking it live right now to Dr. Wu. And if you have any questions that Dr. Wu doesn't answer, it will be answered by the in-house ParentTown team at the end of the session. We promise you no unanswered questions. So feel free, shoot away, get trigger happy, and ask us your questions on childhood myopia.
Thank you. Oh, eye care is something that I hold very close to my heart. In my practice, I see about 70 to 80% of children aged between 7 to 18 years old. The general trend that we see in Singapore is that the children's myopia tend to go up by about 75 degrees to 100 degrees per year in primary school. So between the ages 7 to 12 years old, their power goes up by an average of about 100 degrees per year. Now that's a staggering amount. If you have a child coming in at, let's say, two diopters of myopia, by the time they are from 7 to 12, that's another 6 years. It could very well be -7, -8 diopters, and that basically puts them at a very high risk factor for retinal problems in life. And in secondary school children, from the ages 13 to about 16 years old, the myopia, although the progression is a bit slower, it tends to be about 50 to 75 degrees a year. And even in adulthood, myopia still continues to go up. And this is going to be a big problem in our society. People walking around with very high myopia, it causes a lot of retinal problems, which sometimes lead to blindness. And we try to do our best to try to prevent all that from happening.
So just to understand, so what you're saying is that myopia could potentially worsen in adulthood and end up leading to, even something like blindness.
Well, generally, people always say that past the age of 21 years old, when you hit adulthood, myopia should stabilize, and that is true. But I have seen cases of adults where myopia still continues to go up. We won't call it a jump, but we call it like a creep. So you can go up by 25 degrees, 50 degrees a year. And that's still quite a worrying factor because in the past, myopia progression wasn't that prevalent as well. So right now, we see amounts of myopia progression way higher than what it was just 10 years ago. So we have to do something, and it's not a matter of treating myopia as just a vision problem, wearing spectacles, wearing contact lenses. I think it's more about managing the condition, preventing it from getting worse. What can we do as eye care practitioners to make sure that we don't see patients who are in the high myopia region and end up leading to retinal problems, end up leading to blindness that can really affect their eyes. We often take our eyes for granted. My patients do all the time until they have a problem. So we try our best to not get there. Prevention is always better than cure, right?
Great insights here. For those of you who have just tuned in, we're with Dr. Titus Wu, and we're having a live session right now on childhood myopia. If you have questions, ask it on the ParentTown app, and we'll be answering it. I'm just going to log into the app right now and see what questions we have for you.
Cool.
Okay, we've got a question from Mommy Jacqueline Mong, and she wants to know, what's the main cause for child myopia?
Children myopia. Okay, we first have to understand what myopia really is. Myopia is actually the elongation of the eyeball. So your eyeball, basically from the front all the way to the back, we call that our axis length. In myopia, the axis length of the eye elongates. It gets longer and longer. So what happens is when we look at things, light rays that are entering the eye are now falling in front of the retina. So when they're falling in front of the retina, the patient can't see clearly, so they have to wear glasses to see clearly. They have to wear glasses, they can wear contact lenses, they can go through surgery. So that's myopia, the elongation of the eyeball. Now what causes it? Mostly genetics, unfortunately. So more often than not, when we see parents in my office, and you see two of them, both of them are wearing spectacles, there's a very high chance the child is going to be myopic. And if both parents happen to be high myopic, there's an even higher chance that the child is going to be high myopic as well. So normally what I tell my patients' parents are, if you are -6, don't be surprised that your child can be even higher than you at a young age. And
That's scary.
That's scary. And that's what we see almost on a daily basis. It is happening right now. So besides genetics, we have environmental factors. Of course, we in Singapore, we have our schoolwork, tons of schoolwork. Number one, and of course the government is trying to do something about it. iPad, iPhone, all the digital age, kids, parents are giving their children all these mobile devices. So they are spending quite a lot of time reading up close. Now it's not just the reading. What I notice is that kids like to put whatever they're reading, their books, their iPad, this close to their face. I mean, they can see clearly even at this distance, so the proper reading habits are not quite there. Kids are not spending enough time outdoors. Diet, all these are all factors that contribute to myopia as well.
Oh, very interesting. So this next question here is actually about talking about hereditary myopia. So is it hereditary? My daughter, 5 years old, was found to have astigmatism and had to wear spectacles.
Astigmatism.
Was it a cause of poor eye care or was it hereditary? As both my husband and I have it.
Okay. Most of the time it is hereditary. Okay. But there are certain cases that we see where children have high astigmatism and parents don't have astigmatism. Now there are different types of astigmatism. Some on the cornea, some in the internal of the eye, some at the retina. Most people's astigmatism are on the cornea. So let's talk about corneal astigmatism. Corneal astigmatism is almost like the fingerprint of your eye. Everybody has a bit of astigmatism to a certain extent. It's just how much it affects them. Is it going to cause a problem where they have to wear glasses or not? Now, some kids have high astigmatism. It can be due to rubbing, excessive rubbing of their eyes. I think what's more important is that we want to make sure we do a mapping on the cornea to make sure that we are dealing with regular astigmatism or are we dealing with irregular. If it's irregular, it can be also caused by corneal diseases. And it's very important to pick them up early for children just in case it impedes their vision, they can't see clearly, and it can cause lazy eyes in the future as well. So yes, astigmatism can be hereditary. Generally, it can be exacerbated by rubbing of the eyes, but generally it shouldn't be harmful. It doesn't really progress. So just bring to a proper eye care practitioner, get it checked once in a while, make sure that it's not progressing. If it is progressing, we want to check to make sure it is not a corneal disease that we're dealing with.
Okay. And so we've got a third question here, who is oddly from a girl whose name sounds just like mine. So it's Roshni. And she's asked if myopia is hereditary, which you've already explained it is. But she's asked, is there supplements or foods that you would recommend to strengthen eyesight in children?
Okay, dieting is very important. Our supplements like vitamins A, vitamin C, D, E, lutein, some other supplements like blueberry, those are heard to be good. Now, there are no real medical reports in the medical literature that show that, hey, through long-term studies, taking these supplements makes your myopia better. So we're talking about myopia per se. Does it strengthen your eyesight? Does it improve your vision? Maybe for some conditions, but we have to be clear, we're talking about myopia here. So when the eyeball has elongated, that's when myopia has already occurred. If you're trying to reverse it, you can't really quite shorten the eyeball. Okay, it's there. It is really there. So these supplements can help with vision functions, but in terms of myopia, there are no real concrete studies saying that, oh, by taking such supplements, your myopia will get better. So I'm not going to go out there and say, yes, it's good, but if you ask me, there's no harm taking such supplements. There's no harm maintaining a good diet. It makes your body better, healthier, and that will probably make your eyesight better as well.
So basically, be healthy because it's going to be beneficial some way or another.
Absolutely. Your eyes are part of your body. So if your body is healthy, your eyes generally will be more healthy as well.
Okay, great. Wendy So asks us, how do you tell if a child is short-sighted, especially if he is still not able to read?
Well, that's a difficult one. Generally, we want to make sure that we follow with an eye care practitioner. For kids under the age of 3, we want to bring them to a pediatric ophthalmologist. Sometimes they have to put some certain eye drops in the eye to relax the eye muscles, get it checked properly to make sure that there is no high degree that we're dealing with in there. It's always good to get checked once in a while. A normal pediatrician can help do a quick screening. If there's something that is of concern, of course, he'll send it off to the specialist. After the age of 3, certain telltale signs include rubbing of the eyes, squinting, head tilt, turning their heads to the side, but be mindful, sometimes these can be just nature of habit. Sometimes kids just like to do this. Even when I watch TV, sometimes I find myself in this position. I don't know why.
And I'm guessing you don't have myopia.
I don't have myopia. Okay, I don't have myopia now. I treated myself in that sense. But I still have the habit. Does that mean I can't see clearly? No. But we want to be mindful about that. But do check the child's habit. Make sure that they're not squinting, they're not turning their head to the side, tilting. That all can contribute to, or not contribute, but can be telltale signs that the child might have myopia. Bring them for an eye check just to make sure everything's okay.
Okay. We have Mummy Regina Pei who has asked a question on Orthoke. So she says, nighttime contact lenses have been proven to slow down the progression of myopia in growing children. But I hear that there's very little research to back this. Do you have any research we can read up to learn more about Orthoke?
Cool. I actually responded to that particular reply. I posted a link there that has plenty of research, pointing to the plenty of research in the medical literature, which viewers can of course go there and click it and read it. But Orthoke has been of a hot topic recently. We're talking about the past 5 to 10 years. Plenty of research has been done in America, plenty of research has been done in Australia and different parts of the world, talking about Orthoke, the efficacy of Orthoke, the safety of Orthoke, and we're also talking about whether it's good for myopia control. So on that field, plenty of research has pointed that it's actually a very good source of myopia control for children. Generally, they are predicting results at about 40 to 50% of myopia control. In my practice, when we do custom design lenses, when we cater according to the patient's eyes, we can see up to about 70 to even 90% of control for the myopia progression. Now that means if the child increases at about 100 degrees a year, for example, if you use traditional Orthoke or other methods, you might slow down by 40 to 50%. So instead of going up by 100 degrees a year, you are going up at about 50. With custom Orthoke lenses, sometimes, and with all the factors in mind when you design the lenses, you might be able to bring the power down to the progression to about 25 degrees per year. And that's quite a significant improvement actually. In my case, most of the time we don't see much progression in these children, but we do monitor once every 3 months. To answer the point about research, there are plenty of research online. Some may not be posted online, most may be just abstracts of the particular research. If they want to read the full research, you might have to get hold of some medical journal perhaps. But yes, there are plenty of research that has been done on Orthoke, proving that myopia control is one of the most effective methods out there.
Oh, very interesting. Again, for those of you who have just tuned in, we're with Dr. Titus Wu here in the ParentTown headquarter office in Singapore, and we're talking about childhood myopia. Ask your question. We've still got Dr. Wu here for the next 5 to 10 minutes, and so any popular questions, we're going to be asking it right now. We've got a question here from, let's see, we've got something here from Gosh. Does myopia get worse with age? How?
Well, myopia typically does get worse with age. So let's break it down into the different categories of age like I just mentioned earlier. So we've got your primary school children, we've got your secondary school children, and then we've got adults. And of course, we have toddlers. But let's talk about the ones that are really mostly affected, and we are talking about primary school children. From the age 7 to 12, the average progression per year is anywhere between 50 to 1 diopter. Of course, we see both ends of the spectrum. I see patients whose power never increased. I see patients whose power increased by 250 degrees, 3 diopters per year. So it really depends on the patient to patient. But generally with age, it does progress. After the age of 21 years old, it tends to slow down, it tends to stabilize. Of course, I do see cases where myopia starts to creep. We don't expect a real jump like that of a child. And of course, once you get to the age of 30s and 40s, you do get degenerative changes in the eye, cataracts, retinal problems. All that can really cause the power to change. But would that be getting worse? Sometimes yes, sometimes no. So to answer the question, yes, it does get worse with age to a certain extent. After a certain point, it does slow down a little bit.
Okay. So, and Mummy Avantika has, if you really can't keep your child off the iPad, how long should you allow him to play on it? Also, at what age should they be really using the iPad? Great question, Mama Avantika.
Maybe you can answer that for me. Well, I mean, we struggle, even my wife and I, we struggle to deciding whether we want to pass the iPad to the child. I mean, it's that easy, right? When they're eating their food, sometimes you need to distract them, and you find that distracting them with an iPad movie in front of them, it makes things a lot easier for you. The problem is when the kids get addicted to it. The problem is also when they have poor habits. So instead of reading at a particular distance, at about 40-45 cm, they're reading at about 10-20 cm. Now that's a problem.
Define addiction. What would you consider to be?
Like they really need it for whatever they do. Okay, every single moment they're awake, they're asking, "Mommy, can I have my iPad? I want to read my iPad. I want to play my game. I want to watch a show." Things like that. Now that might be addiction. At what age should we start using iPads? That's something that I can't really answer for you. Okay, I think anywhere, as long as they're able to see clearly, as long as you get your eyes checked regularly and know that the eye is healthy, it's okay to let them use the iPad, but always in moderation. Perhaps 20-30 minutes, and always take 20-30 minutes break. Now what's more important is that besides this iPad, bring your child outdoors, spend some time outdoors. Okay, there's proven research that shows that with adequate sunlight exposure, myopia can be slowed down. Look at greenery, that's all good for the health of the eyes and the power of the eyes. We've heard that before. It really does work. Bring them out, play in the sun, play ball perhaps, see something far away. That's always going to be good for the eyes. Yeah.
Okay. We've got Mummy Sin Zi Chu. I hope I pronounced your name correctly. But any preventive evidence-based advice for and against the optimal visual development in childhood? Example, lutein, screen time, eye exercise.
Well, there's a lot of research done on eye exercises and myopia as well. Lutein, for example, supplements, people do talk about that. They are mostly anecdotal, which means you don't really have a grounded research proving that it really works in the long run. I'm not too familiar with eye exercises, I can't really comment on that, but I do know of parents who have done plenty of exercises, but it doesn't really quite work. And I've also seen parents who have done exercises and have raved about it. Okay, I think what matters is to underline and to understand the different diagnoses of the conditions of the eye. From there, we can cater the management and the treatment accordingly to the patient. In terms of supplements, I've touched on that before, so I think while mostly anecdotal, there's no harm taking such supplements. Lutein, for example, is very good to strengthen the retina, to build, especially for people for age-related macular degeneration in older folks. So that to answer your question.
Okay, we've touched a little bit about supplements, but any Chinese supplements that you might recommend? Because anonymous mom here says, is this true? Chinese doctors claim some Chinese herbs can improve myopia.
Well, similarly, mostly anecdotal. I'm not saying that it doesn't work. I've heard parents say that they've done this for their kids for many years and their power has improved. And I say, hey, good, that's really good. But for me to go out there and to tell my patients that, hey, look, take this and it's going to make your myopia better, that's going to be a lie. I can't say that to them. What's been proven though to slow down progression, not to make it worse, but proven to slow down progression are generally orthokeratology and atropine eye drops. Of course, there are some certain type of bifocal or multifocal contact lenses and spectacles that can help a little bit as well, although not as effective as orthocate and atropine. But these are the two main treatments that basically garner a lot of efficacy in terms of medical literature-wise.
Okay. We're going to only ask our last two questions. So if you've got a question, please ask it right now. If it gets voted up, we're going to answer it. We have a question from Mom Deepa Shah, who actually touches on ortho-K as well. And she asks us, what are the risks of ortho-K?
With ortho-K is like a contact lens, but we are not supposed to sleep with contact lenses. We all know that. And I tell my patients that all the time. We're not supposed to sleep with contact lenses. But I'm referring to soft contact lenses. Now, soft contact lenses act like a sponge. So it draws water out of the eye, which is primarily made out of water. Now, ortho-K is different. It's like a cornea mold. We call it a cornea mold in my practice. It's specifically designed for the cornea to sit on a bed of tears, to gently reshape the eye, so it doesn't actually mechanically touch the cornea. If you actually mechanically touch the cornea, then you're going to get abrasion. Now, with everything or any foreign object that you're going to place in your eye, be it a contact lens, be it a PROSE device, be it an ortho-K lens, we are always going to be talking about risk. We want to make sure that the lenses are well fitted. We want to make sure that the patient is responsible for the compliance of the lens care. We want to make sure that parents are involved as well to make sure that their hygiene is there, they're keeping their hands clean, they're keeping their eyes clean. If we do all that right, the risk of getting an infection is very, very low. Okay, medical research has shown to be about 7 in 10,000. So that's a very small number. But we want to make sure that we don't even see any infection cases at all. So we follow up very regularly with our patients once every 3 months. We show pictures of the cornea, we show pictures of how the lens is sitting in the eye. We want to make sure that the lens is centered properly, is clearing the entire cornea. Cornea is nice and healthy, and we want to make sure that power is good. So these are the 3 priorities that we always talk to our patients about. Okay, the lens centration, the health of the cornea, and the power, and whether the power is under control or not. So every single visit, we pay attention to this, and generally the risk is very, very low. We mitigate all the risk by making sure that our patients are compliant as well.
Okay. So follow the doctor's advice to the T and nothing should happen.
Absolutely, because sometimes people don't follow the advice. Sometimes you have kids going around touching things on the floor and then rubbing their eyes. So obviously, if you know that your child happens to be one of those, then you might want to think that, hey, this may not be the best option or best treatment for the patient.
Mm-hmm.
So normally in our practice, we go through the entire lifestyle of the patient. We talk to the parents. We want to make sure that this treatment is safe as it can be for the patient. So we want to make sure that they are okay. We want to make sure that these patients are going to listen to our advice as well. So if they're not going to be listening to our advice, they are not going to be complying with putting lens on regularly, coming back for regular follow-ups, then we might have to drop the patient or turn the patient away.
And so our last question for today, we're doing, what's your recommendation of checkups, screening on normal child with high risk, example, parents have myopia, in terms of frequency and which specialist?
Okay.
Optician versus ophthalmologist.
Okay, an optician basically is responsible for dispensing of glasses. Of course, they are able to check the power of the eye as well. But an optometrist is able to go into further details to check about the eye length of the eye, the health of the eye, to make sure that every single part of the eye is working in good order. Same thing for an ophthalmologist. Now, depending on the age group of the patient, okay, of course, if it's a child less than 3 years old, you may want to bring to a pediatric ophthalmologist. Anything above the age of 3 to 6, you might want to bring to a pediatric optometrist who's able to just make sure that both eyes are working properly together. Anything past the age of 7 years old to about 16, 17, 18 years old, you can see an optometrist for that. They can check the health of the eyes, they can monitor the progression of the eyes, and you can also see whether there's a need for contact lenses, there's a need for glasses, for example. Now, how regular should the checkups be? If there's no problem and there's no progression, we normally recommend once a year. Okay? But if we do detect progression in the child, let's say every 3 months we are seeing the child at about 25 degrees of increase, we want to see them back every 3 months just to make sure everything's okay first. And nip it at its bud if we detect that it's going up too fast. So recommended is always once every 3 months for the first year. Once we have detected and mapped out the baseline of the child's eye, then we'll see if we need to see them back once every 3 months continuously, or do we see them back once every 6 months or once a year. Generally, those that have a problem, either a progressive myopia or corneal diseases, we want to see them back quite often. If the child's eye health is very healthy, the power is not progressing, they can see very clearly without any glasses, You normally can see them back once every 6 months to once a year, depending on their age.
Okay, great. Thank you so much,
Most
Dr. Wu.
welcome.
Do you have any last advice for our parents who have tuned in here? Any tips?
Basic tips for them: always spend more time outdoors. I always like to say this because we know that in the past, hunters in America or in other countries tend to go out there and they start hunting. And what they do, they're always outdoors in the sun, looking at things very far away, training their eyes to see things as far as possible. And in our day and age, we're not doing that. We're not quite doing that. Everything is at an intermediate region. Everything is up close. So our eyes are not trained to see far very clearly. So those guys who are hunting, they don't ever wear glasses, unless of course it's genetics perhaps. But the prevalence of myopia is very, very low. Whereas the prevalence of myopia in Singapore for children is about 60%. 80% once we hit adulthood. That's a big difference. We can do a lot more just by changing your lifestyle, just by changing your diet. You can do a lot more for myopia progression. If myopia is really progressing, be thankful, there are other options and treatment options that can help control the myopia. Of course, we need to find out from the parents first. We need to see what option is best for their lifestyle. What are the parents comfortable with? Not every parent is comfortable with putting something into the child's eye. Not every parent is comfortable with putting a chemical eye drop in the eye and seeing the side effects of dilated eyeballs as well. So it depends. It depends. We need to talk to the parents and make an informed decision with them, and we will let the parents choose which will be the best for the children.
All right. Thank you for all these amazing advice, and thank you for joining us for our inaugural Ask the Expert
Thank you for having me
session
here. Thank you.
here on ParentTown headquarters. For those of you who have just tuned in, I am really sorry, but the session has just ended. But feel free to keep asking your questions. Either Dr. Wu or someone else from the ParentTown team will still be answering your questions, just it won't be live on video. And for those of you who missed this whole video, you can watch it on YouTube. And do check out the rest of our videos as well. And we'll be having another Ask the Expert session next week with another doctor. So do keep tuning in, asking your question, and have a great, happy parenting. And thank you, doctor.
Thank you very much. Have a great week ahead.